Uganda has made commendable progress by reducing the HIV prevalence rate from 30% in the 1990s to 7% in the mid-2000s. However, poor health facilities, shortage of skilled health workers, and challenges such as infrastructure, equipment and supplies, drugs and transportation have hampered the national response to HIV and TB. In response to these challenges, the US government's President's Emergency Plan for AIDS Relief, PEPFAR, and the United States Agency for International Development, USAID, amongst others, supported the Ministry of Health to formulate strategies to strengthen HIV and TB services in Uganda. As part of the US government's support, PEPFAR funded the USAID Strengthening TB and HIV and AIDS Responses in Eastern Uganda STAR-E project to support the Ministry of Health and its district health teams and facilities to provide comprehensive HIV and TB services.
The design was that partners who received grants substantial enough to support TB, HIV collaborative activities had to be allocated big chunks of the country, and so STAR-E ends up supporting those 12 districts in the Busiu sub-region.
Implemented by Management Sciences for Health, MSH, a core function of STAR-E was to support the ministry to roll out new guidelines to districts and their health facilities. Key elements of the rollouts were training of health workers followed by on-site mentorship.
They have been a leading partner or project in terms of innovation, bring on board innovation. When it comes to policy adoption, policy review, and the Ministry of Health pronounces itself on a certain policy, they have always taken a leading role. An example is in 2010, they supported us in the rollout of the national HIV testing policy that included provision of provider-initiated HIV testing and counseling. They were one of the early adopters of that. Trainings of trainers are aimed at creating a critical pool of highly knowledgeable and technical people who are then going to guide the frontline service providers, build their capacity to deliver services. And we are talking about quality, comprehensive HIV services at the facility and community level. So this is how the partnership has worked.
Poor infrastructure and the lack of adequate space and equipment in health facilities have been significant hindrances to the provision of quality health services. As a result, STAR-E supported 11 health facilities to improve their infrastructure and acquire more space through renovation of buildings and expanding laboratories and other service areas to cater for the large number of HIV and TB patients.
It was renovated. When you look at it, is the best of all buildings. And now it is the one that is accommodating all the HIV, TB services. We have adult clinic, children clinic, family planning, we have nutrition, we have the lab within that old OPD.
Before STAR-E came, in 2009, we were in a Kavira lab, a very small room the other side. Very small room with one microscope and a centrifuge. But when STAR-E came, they came and renovated this building. This was a very old building which was abandoned, not even in use. But STAR-E put it right. You can see it looks a new building. And all this equipment that you can see now came because we have this capacity, because they could not bring those equipment in that lab.
STAR-E supported the Ministry of Health's establishment of a hub laboratory referral system with 6 hub laboratories serving the 12 districts and their health facilities.
With the help of STAR-E, we have been able to establish a hub laboratory system which ensures that all of the tests, all of the samples that have been removed from our health facilities, they are taken to the laboratory for testing, and those that cannot, the tests that cannot be conducted there, actually they are referred to the Central Public Health Laboratory.
To ensure quick and proper movement of samples, Star E supported 13 sample transport bike riders for the 6 hub referral laboratories.
At first, we were trained in sample management. Then we got a training in record keeping and generally how to manage samples from lower health facilities to the hub. The turnaround time for the samples we take to Kampala is about 2 weeks.
Star E supported the district health teams to conduct support supervision of their facilities and for health facility staff to mentor lower level health facilities and their health workers.
Star E has supplied computers to all the health center 3s and 4s of the district, and these computers are helping us in health data processing. It has trained 25 records assistants in health center 4s and 3s, and really this has helped them. It has also trained the clinicians and the midwives in data recording. It has even me as a biostatistician, I've got technical support from them. They have really helped me to understand the data elements, the indicators, to interpret them and even to analyze data. As we all know that data analysis helps us to go to another level of decision making and planning.
We have been able to be trained as medicines managers. I'm one of the medicines management supervisors in the Bududa district, and through us, Star E project has been able to help us train health workers, coach them and mentor them in the area of medicines management. So health workers at our health facilities from Health Center 3 onwards are now able to quantify essential medicines and ARVs, and they're able to order for those medicines.
We are more empowered, and we've got attachment to our clients, because at first it's like working in the art clinic. Most of the health workers, some of us didn't feel like working in art clinic, but with the knowledge that we went on getting, we feel very comfortable to work with, to help our clients, and we are very happy that our clients are progressing on well. Our children are not born with HIV, which also brings pride to us. Being a nursing officer, I picked interest in the EID clinic also. So it's like I had passion in those mothers with their babies, and there was no baby who was attached to EID clinic that the mother was on PMTCT that got HIV.
Star E trained and deployed HIV-positive paraprofessional expert patients at supported health facilities. These included case managers at ART clinics for supporting HIV clients and mentor mothers at mother-baby care points for supporting HIV-positive pregnant and breastfeeding mothers for the elimination of mother-to-child transmission.
They have given me so many skills, especially in counseling and health education. When I get in the community, I can be able to counsel a mother, that one who had stigma. I can counsel that mother and bring her to the health center for treatment, and she comes and the class for my counsel. They are very good and they adhere very well.
For those who have given us forms, we use the relevant phones that Star E gave us to contact them. And for those who don't have phone, we just make a physical movement to the addresses given.
For TB patients, sub-county health workers were supported to sensitize communities about TB, screen and refer community members with possible TB infection, and follow up to ensure their adherence to medication.
We even trained the sub-county officials to continue announcing that TB treatment is available at anything. So we told them, once you see any person coughing more than 2 weeks, tell him to come to the unit.
Star E trained peer educators from key and priority populations such as female sex workers, men who have sex with men, out-of-school youth, fisher folk and border taxi cyclists to provide HIV and health messages to their peers as a strategy to reduce HIV infection in their communities and to ensure those infected receive care and treatment.
The trainings we had majorly was about HIV. So about HIV we learned about love and sex, condom use, family planning, STDs.
I had fear, but later I had to give in my life for testing. I tested, and when I was called, there was a lady who was giving out the results. The lady was like, "You are HIV free." I never believed it. I never believed it because I knew my background. My background was a bit rough. I saw that being a very special thing in my life. I found out my life was now expensive because there's nothing expensive more than life.
These interventions have helped strengthen Uganda's decentralized health system in the eastern region, which has improved HIV and TB services and ultimately resulted in a more vigorous response to HIV and TB in eastern Uganda.